I'm Dr. Matthew Delury here in the emergency room at St. Joseph's Hospital. Today we'll be giving a brief introduction to our airway equipment that we have available for the providers in the emergency room, so that when you need access to the emergency equipment for the airway, you'll be able to know right where the equipment is here in the emergency room. We'll start by going through the adult airway equipment and then move to the pediatric and then the neonatal equipment that we have in our emergency room. The airway cart is located outside of bed 4. Moving in a top to bottom approach. The top box is our grab and go box. It's not bolted down at all. When we open it, this is the airway equipment for your basic run-of-the-mill airways. In the top we have our laryngoscopes for adults, both disposable and non-disposable with it. Moving further in, we have our 10 and 20 cc syringes, our CO2 monitors, our trach collars. And then in the bottom are our ET tubes starting with 6O going all the way to a 9O. We also have our Miguel forceps and our stylettes in here. The grab and go box should be useful for all routine direct laryngoscopy equipment. The box can be taken off of the cart and taken to any room. The goal of the airway cart was designed so that as you move further into the cart, the more advanced or difficult airway equipment will be used. In the top airway, you have your nasal airways, your oral airways, your additional tube holders if needed, your bite blocks, and your routine syringes that can be used. As you move down into the second, you have your additional adult ET tubes starting from the 6.5 going all the way to the bottom, whereas the 9, you have your additional stylettes, your lube if needed. These are some unusual 6O tubes that we have available with a very tight end on the bottom that can be used. They only come in a 6O size, however, there are 2 of them in here. In drawer number 3 is our first video laryngoscopy. The Miguel airway device has a button on the side. It works for video laryngoscopy. We have it set up in our department for both 3 and 4 blades for adults. Here's our extra disposable blades coming in all shapes, the Millers and the Max, ranging from all shapes and sizes, again for adults only in this box. Moving down to the 4th drawer is some of our supraglottic devices. We've chosen to have 2 of them here at St. Joe's. Our King LTs, sizes 3, 4, and 5 for adults. And over here are our air cues, again in the adult sizes ranging from the 2.5 up to the bariatric 4.5. These also have a tube exchanger within here so that you can intubate through our air cues. In the 5th drawer is our glide scope drawer. We have all 4 sizes of the disposable airway from the 3 to the 4 to the 2. If you are going to use the pediatric sizes, and this is the only pediatric equipment in here, you will need to change out to the pediatric light fixture that does come to the glide scope. Again, this is the only pediatric equipment we have in this drawer. In the bottom drawer is our truly difficult airway equipment. We have a sterile fiber optic laryngoscope that we can use. Anesthesia and ENT have also asked to use this, and so we do keep it in our bottom drawer. It is sterile and available for use. We also have our quick crike kit available. Within it, we'll demonstrate the exact pieces of it, but we have our crike kit in the bottom drawer. And then we have our jet ventilation equipment in the bottom drawer for both adult and pediatrics. We'll demonstrate this as well. And then in the bottom is unfortunately grown over the years a hodgepodge of various equipment for respiratory therapy. Most of it has to do with suction equipment that the respiratory therapists use. For the physicians, the big things will be the laryngoscope, the crike kit, and the jet ventilation kit. On the side of the airway cart is 2 other important pieces of equipment that I want to make you aware of. We have our bougies that we keep in the side here. And then there is another laryngoscope we use. We call it the ambuscope with it. We have 2 scopes in here. They are sterile and they are quite expensive, so we really ask that you only use them if absolutely necessary. A couple of important pieces with the ambuscope is once you open it, you need to connect the actual scope into the monitor with it. It's important to make sure that the ambuscope is plugged in properly. It will not work on battery power. 2 power buttons that need to be turned on. One is on the monitor itself, and one is on the scope itself. Both must be turned on for the scope to work properly. To adjust the scope up or down when in the airway, the green lever simply moves up and down to move the scope up and down in the airway. But remember, both power buttons must be on in order for the ambuscope to work properly. We'll go ahead and open the quick crate kit so that you guys are familiar with it before you need to use it. Inside we've put a 6.0 ET tube as well as a standard adult trach. There are 2 different kinds of retractors that we have available for your use. We've put some sterile towels within there. There are 2 different sterile needle drivers, several different scalpels, and then any suture material to close in the trach kit. Of note, there are no 4x4s in this kit. If you would like 4x4s, the nurses will need to get that for you separately. As a reminder, this quick crate kit is in the bottom of the airway drawer. The jet ventilation box is also in the bottom of the airway cart and has 3 different pieces of equipment in it. There are 2 different needles that can be used for the tracheal jet ventilation. One is designed for children, one is designed for adults. They are different colors. The one for the children is yellow, the one for the adults are blue. They have a lure lock already within them to make an easy setup with the jet insulation device. The actual insufflator has to be plugged into an oxygen port in any room. To make the oxygen flow in the insufflator, you would plug this directly into your jet needle or any angiocath that you have available, and then you would have to plunge in the gray port, watching for chest rise and fall. To change the pressure settings, it's either a clockwise or a counterclockwise motion on the black knob to change your pressure settings. Here in room 4 at St. Joe's, we have some equipment that can't be found anywhere else, and I would like to make sure everyone is aware of where the equipment is. Starting in the upper left-hand corner is our thoracotomy tray, a tracheostomy tray that the surgeons prefer, and then thoracentesis, paracentesis trays. Next to that are the chest tube trays that our cardiothoracic surgeons will prefer. These are rarely used by the emergency physicians, but our cardiothoracic surgeons will utilize these more surgical heavy trays. Next to that are the actual Pleurovacs, both adult and pediatric, that we would use if placing a chest tube. These do not have the ability to auto-transfuse blood, however, but these are the Pleurovacs that would be used with a chest tube. Next to it is some additional tubing, trach ties for our chest tube equipment, as well as some additional suction equipment and esophageal probes for measuring temperature. Moving down to the second tray down are our chest tubes themselves, all banded in a variety of sizes, the largest being 40 French and the smallest being 12 French. Next to it are the chest tube insertion trays that us as emergency physicians often prefer, having everything available within it that can place a chest tube. Next to it we have an additional jet ventilator equipment. This is the exact same as the one found in the lowest drawer of our airway equipment. Further down are our 2 central line kits. One is a triple lumen and one is a cordis kit used for massive hemorrhage. These have everything necessary in the kits to use. Our restraints, IV and art line setups, additional crate kits if necessary, as well as some backup airway equipment. Of note, there is an additional Melker cricothyrotomy kit in here if you prefer the Melker setup for your cric kits. Now to the lower part of the cart in room 4 at St. Joseph's Hospital, we have various art line setups if needed. We have our IO drill and various needles ranging from the infant to the pediatric to the adult and the bariatric, surgical caps, shoe covers, a transvenous pacemaker setup including the actual pacemaker catheters, some sterile gowns, lumbar puncture kits, an OB delivery setup, with everything needed to deliver a baby, as well as our blood and fluid warmer that can be used with trauma or anytime you need to warm fluids for a hypothermic patient. All of this is available in room 4 here at St. Joseph's Hospital. Outside of room 4 is our pediatric cart. Of note, it is locked with a combination lock. The nurses will have to open it for us. We have a variety of medications through in it for the pediatric resuscitation, including a pediatric-specific ambu bag, airway masks, nasal and oral airways. There's also specific pediatric suction equipment. Of note, in the bottom is a orange tackle box similar to the adult grab-and-go airway box. That has our endotracheal tubes and our laryngoscopes for all the various pediatric sizes. That'll be a very important thing for providers to know, that in the bottom is our airway equipment for the pediatric patients. For the very little patients, outside of bed 4 is also our neonatal equipment, including the warmer, another OB vaginal delivery pack, and our neonatal recession kit. This has endotracheal tubes as well as laryngoscopes down for the neonatal cases. It should be noted that we have a 24-hour neonatal team here at St. Joe's. Anytime you are doing neonatal resuscitation, the neonatal team can come down and assist you. They also have an umbilical line kit that we can use if we prefer. This was designed predominantly for the neonatologists when they come down and assist, and so if we don't feel comfortable using it, that is just fine. Our additional ET tubes here at St. Joseph's is stored in a storage room down the hallway from room 4 down where the ambulances enter our emergency room. On the 4th shelf down in the storage room is our additional ET tubes, ranging from the neonatal 2.0 all the way up to the 9 for adults. You can have the nurses or the techs just bring this entire box if you're unsure of what size you'll be needing. Particularly helpful in the pediatrics when you may not know what size you need.